Morningdove Bain, and she is a psych nurse, has been a psych nurse all of her career. And let's hear what she tells us.
Hi, everyone. Too close? Close enough? Okay. All right. So I would like to just thank you for being a nurse and participating in the community for mental health advocacy, because that's very much a missing aspect. Before I forget, because I'm old, I have been a psych nurse for most of my career, working in different capacities, starting at a psych tech. So I know the backwards of the oldest psych hospitals and the forward crisis triage. So I've kind of been through the ringer. Mr. St. Pierre is correct. Is it doctor now?
Yes.
Okay.
I do my Peterson. I like Peterson.
Okay. Peterson, or Dr. St. Pierre, is correct. Not only are we missing some critical educational opportunities, but in fact, some critical educational opportunities have been retracted from psychiatric mental health nursing. In fact, the clinical nurse specialist was retracted by the board and sort of in favor of doctoral programs. And so if you want to be a doctor, a DNP nurse practitioner, there's a place for you. But if you wanted to be a clinical nurse specialist and focus in assessing and advising and planning and helping and with dispositions or placements or just the really in-depth part of psychiatric care, that specialty was dissolved. I'm not sure why. To my disappointment, it's gone. So I think if we want to start someplace in education advocating, I think there's a place to advocate for a clinical nurse specialist. Not everybody wants to prescribe medications or see patients every day and follow up. Some of us, like the sort of down and dirty triage stuff, see them and move on. So that's my educational piece. In terms of family, being a nurse and having family with mental health, having been in, I don't want to say 42 years, but it might have been that long. I must have started when I was 2. Having been in mental health for a very, very long time, I can tell you that at some point in every family's life, you'll have somebody who has mental health needs. Whether or not they were ever on a 5150 or you became savvy with the system, everybody has family that has mental health needs. And if they didn't before the pandemic, they do now. There's a lot of times where there's family needs for mental health issues that doesn't get discussed. It's not talked about. So, I want to encourage people that having conversations about mental health and mental health support is important just in our community to support our own peers, because we all have somebody in the family, and sometimes it's ourselves that need more or less support this week than others. So that's my family member. Having been a nurse trying to place patients, family members from the ER, having been that same nurse that sent that family to the emergency room for care, knowing that the emergency room that they were probably going to wind up at was already at double capacity and not in a place to really provide meaningful care, not because they don't want to, but simply they just don't have the resources. It's a double bind. Having screening patients at the position I most recently left before I started teaching, I would screen patients over the phone live, either themselves or with their families, and would have to have in my head a really clear triage tree of who needed to go and who could wait, and communicate effectively to the family why waiting was a better plan and what they could do. So communication between mental health crisis and the family became essential. And developing language to talk to people in a really sincere and honest way, and at the same time tell them, look, today's not going to be a good day for that. I know you're hanging on by a fingernail and a scrape and a crumb, but you need to hang on for 16 more hours because the people you really need to see will be here. They're not there. right? And then making that decision that in spite of COVID, this family needs to go, and knowing that I'm just overwhelming the ER, and people are going to go home and not come back because of that. It's a real double bind, and part of that is resources and how those patients got there in that crisis situation to begin with. And there's so many places we could address. Everything like my experience with working with hospital emergency rooms that had dedicated psych ER versus medical ER, and my impression of the difference in care, as well as the difference in documentation, to emergency rooms where everybody was in the same ER. And it just is what it is, right? So there's a whole conversation about that particular dynamic. The other thing that's maybe more ambiguous and more vague, I don't have any seats in any community councils, but for a time, currently COVID's sort of knocked that out of the park, but for a time I participated as a parish nurse in my church and in my parish. And a couple of things happened with that. That specialty was also not given credentialing by the National Credentialing Center. They withdrew that. And in doing so, withdrew volunteer nurses that were interested in and aware of their parishes, their communities. And it wasn't limited to traditional, like we think Catholic parish. It was any faith community nurse that worked within their faith community, and it included Jewish communities, Muslim communities. And so that certification was withdrawn before it ever got ground. And then COVID came, and with COVID, all of the social community supports that were kind of in the background that healthcare is aware of for referral sources but didn't actually use, the rug was pulled out from under all of them. They were told, not only can you hold services and talk to people and provide comfort and emotional support and hope, not only that, but you can't go visiting at their houses, and you can't bring them things, and you can't share. So the increase in populations in the emergency rooms of what we lovingly call the worried well, right, doubled. And there's no resource for them because they don't meet the criteria for admission, and yet they're so stressed out and anxious, they feel like they can't be at their home. So there's a lot of opportunities in our community. It's unfortunate that with the impetus of COVID, there's so many needs that it's hard to just sort of find a focal point, right? But I would encourage people, there's lots of places to start. Just ask the people that are providing that care, and they have ideas, I'm sure.
Thank you.